Welcome to episode 2 of the Invisible Iconic podcast. I'm your host, Alex, and on today's episode, Hysterical Karens. Ultimate burn, or are we endometriosis sufferers just living in the modern day equivalent of the witch trials? Except this time, it's not the stake, it's ablation. So in today's episode, I've invited Jorja, Dana, and Diane to discuss some of their experiences, both with treatments of endometriosis, as well as some of the gaslighting that has occurred during the diagnosis journey.
Hi, I'm Jorja. I'm 16 and I have endometriosis. No one in my family has diagnosed endometriosis. I guess because my symptoms for my mum, they were not normal. So she was my biggest advocate. She knew something was wrong. She didn't experience this, so she knew that it wasn't normal and helped me get my diagnosis.
Hi everyone, I'm Diane. I'm 42 and I have endometriosis and I'm about 8 years post-hysterectomy for adenomyosis as well.
Hi, I'm Dana. I'm 30 years old. I've had excision surgery for endometriosis last year for stage 4 deep infiltrating endometriosis. And I work as a resident doctor in Bucharest, Romania.
None of our guests today, nor myself, have received any compensation or instruction from any professional organization, private or publicly traded, any not-for-profit businesses that benefit from research, pharmaceutical or surgical equipment, or centers of care. Dr. Wendy Bingham, Executive Director and founder of Extrapelvic Not Rare, a not-for-profit organization for extrapelvic endometriosis, spoke at the Endometriosis Iceland Symposium about endometriosis's established perception, the reality, and the need for revolution.
I'm here as a physical therapist who has lost her ability to perform in the clinic due to this disease as an undiagnosed person for 30 years. Between what's happening in the patient world and what's happening in the medical world, there's a lack of communication, as well as at one time being that patient and going from a practitioner where I was in control to being somebody who was not in control and was gaslit and left to live in a reclining chair for 2.5 years because nobody believed me. This is the reality of this disease. It used to be called hysteria, and we still hear the word, and we all can't stand that word. Hysteria used to at one time believed to be an organic disease, meaning that there was a real reason for it.
The established perception of endometriosis is that primarily it happens to females between the ages of 15 and 49 who have a uterus, are infertile, and who menstruate. So John Sampson's theory of retrograde menstruation, which tells us that endometriosis occurs because of your menstruation flowing back into your fallopian tubes and then depositing around your reproductive organs, is the reason why endometriosis happens. Endometriosis does actually occur in all sexes and all genders. So it's been found in cis males, it's been found in intersex people, it's been found in trans people. It's also been found in animals that don't menstruate. In 1962, Linton Snaith said, "One suspects that a psychopathic personality is often linked with a disposition towards endometriosis." So why is that important? Because today, people with endometriosis are still being gaslit. When these treatments fail us and we have ongoing pain despite these treatments, which are all based on retrograde menstruation, particularly the pharmaceutical and medical treatments, we are told that our symptoms are psychosomatic. We get told it's central sensitization. We get told to do yoga. We get told to drink celery juice. We get told to have ultrasounds that don't show our disease in terms of excision versus ablation. When they're burning this tissue, there's nothing to send to pathology to actually confirm the diagnosis.
Endometriosis, it's a chronic inflammatory systemic disease. It's not something that you take hormones for and it just goes away. Even if you have excision surgery, there is a possibility that so much damage has been done, or that they miss some, or that your endo recurs. Like even with expert excision surgery, there is still the chance of recurrence or persistence. I asked people, if you have endo or adeno-associated pain, have you been told that you have central sensitization? 75% of people said yes. And of the people who have been told they have central sensitization, 80% of them were not assessed against any of the diagnostic criteria that exist for central sensitization. It is GPs, it is psychiatrists, it is gynecologists who are telling people that they have central sensitization. You haven't responded to hormones. I don't want to prescribe opioids. You don't want to take neuropathic meds. You have central sensitization.
That's the exact point. Not only are they giving you a diagnosis based on what they think they know without any actual indication that it's relevant to the criteria, but then they're going ahead and prescribing treatments, just like with the conversation around how diagnosis is not enough, like imaging in order to get a diagnosis and then putting us on this host of medications. It can be really dangerous to think that someone has endometriosis without doing a laparoscopy, which, as we know, is the gold standard, has been the gold standard for like over 50 years, you know, for diagnosing and removing the disease. Because why? Because then when you're excising, you can cut out a little bit of the disease, you send it to pathology, they look at it under a microscope and they say, yes, this tissue that isn't the endometrium may have progesterone or estrogen receptors so therefore it is endometriosis. If they don't do that histopathological examination, they could be treating any other disease. They have no idea what they're treating.
Central sensitization syndrome or syndromes is kind of an umbrella that a lot of things fit underneath, right? So fibromyalgia is one thing that can fit underneath that. And so can some types of neurodiversity, and also PTSD can fit under those things. And there's lots of different components to central sensitization. Usually it means that you might have hyperalgesia. So you feel pain to stimuli which are in general not painful. You might feel a hypersensitivity to cold or to heat that other people don't feel. So, you know, one of the basic clinical tests might be to get somebody to stick their hand in a bucket of ice water and see how long they can deal with it for, right? So you might find things that are painful that other people don't find painful, you know, and I'm not, you know, saying that there's no place for psychological therapies in helping people manage chronic pain and central sensitization. But the problem is there are so many different types of pain now, and it's almost like as soon as your pain is non-cancer pain, it becomes not real. And they lump all of the different types of non-cancer pain in together. And we know that opioids are an effective treatment for the pain caused by a sickle cell crisis, right? But that is still non-cancer pain.
The next set of questions are around our mental health. So I would like to put a trigger warning. If you have had any mental health diagnoses, were they diagnosed prior to your endometriosis, adenomyosis, pelvic pain, or after? And do you feel that these are accurate diagnoses for you?
I think I was 38 when I was diagnosed with ADHD. So the first time that I really had a significant mental health diagnosis was I had a workplace injury and was diagnosed with adjustment disorder with mixed depression and anxiety as a result of that. So essentially I had PTSD from the workplace injury, which was caused by being over-medicated for my pelvic pain, which was caused by endometriosis. The only reason I have post-traumatic stress disorder now is from medical trauma, from the way that I've been treated in hospitals, particularly by pain management services and anaesthetists. That's the medical trauma. It's a cycle, as one thing caused the other. Like, I'm 100% certain that having PTSD does not help me deal with my pain in any way, but it also is not causing the pain. The pain is the reason that I went to hospital, and hospital is the reason that I have PTSD. And my pain specialist in particular is such a lovely, lovely person and so empathetic and so compassionate, but really struggles to understand how any of his colleagues could not be as compassionate and empathetic as he is, and so struggles to understand why I don't want to go to hospital. I think a lot of people have been treated badly in emergency rooms, but you get treated a certain way, you become accused of being a drug seeker or a hypochondriac, and you start to become very reluctant to seek medical attention when you probably, you know, shouldn't be trying to manage it yourself. My trauma has made me so reluctant to go to hospitals and so reluctant to trust surgeons and anaesthetists. Now I find myself essentially relying on my GP and the pain specialist to manage things that would be safer in a hospital setting, but I can't bring myself to do it. And each time the same thing ends up happening. So you're already primed for trauma and then you experience more trauma.
Jorja, did you have any mental health diagnoses prior to your diagnosis of endometriosis? Were you treated any differently after?
Had lots of traumatic things happen when I was small. I was also born premature and had 6 months of my life spent in the hospital. Just from being 6 months to around 7, my life was very much in and out of hospital. Not typical childhood. Also had my parents' divorce. Yeah, also when my endo symptoms started, I started getting symptoms of major depressive disorder. saw my first psychiatrist at 14. So I've been on antidepressants, bunch of different ones, since the age of 14. And then I got my endo diagnosis. And because I had those diagnoses of anxiety and depression, they were kind of like the pain psychosomatic. You're trying to get out of school. Because at the time I was missing a lot of school because of my pain. So then once I got my diagnosis of endo, I still had pain after my surgery. They tried to say, well, it's the sensual sensitization, it's the anxiety, it's the depression. I guess having a mental health diagnosis just impacts a lot with how doctors treat you around endo. When they thought it was primary dysmenorrhea, they put me on the pill, and then they said, okay, we'll put you on a medication called amitriptyline. They slowly increased my dose until I was on 50 milligrams, and it wasn't helping at all with my pain. When I was on that high dose, I started getting full body just shakes and tremors. Like I would just be sitting there and my whole body would just shake, and I didn't really know why. So I went to my doctor and they said, could be serotonin syndrome, because I was also on another antidepressant at the time. So they took me off that because you have to be weaned off it. Once it was fully out of my system, I had just full body shakes and tremors for about a month. And they decided, we'll put you on Lyrica. Like at the time, I was just, if anything helps, basically, because I had endo surgery and I actually had excision. But we think at the time I wasn't diagnosed with Gynaecology. That was missed. So probably a reason why I was still in pain. So I was put on Lyrica. I guess when it wasn't doing anything, they just slowly kept bringing the dose up. So I was on 450 a day. Like my major depressive disorder got worse. Like it was treated before I was on the medication. And then when I was put on the medication, just relapsed. I was also suicidal, self-harmed. At the point when I was at 150 food grams a day, I was so scared I was going to do something. I begged someone to take me to the hospital so they could basically admit me to the psych ward. So I wasn't self-harming before I was on Lyrica. I think Lyrica just kind of messed up my head. It had no effect on my pain.
I was going to ask, you're a child,
Yes.
your brain's obviously not developed, and they're giving you 450 milligrams of a nerve pain drug that was originally made for epilepsy.
Yeah. The doctor at the pain clinic basically just kept saying, just keep waiting, it'll work, it'll work, it'll work, the whole time. Then after the psych ward admission, I was still on Lyrica, and I had an endo flare-up because my endo pain wasn't controlled. So I was in hospital. Pain specialist I was seeing cut me off of all painkillers because she said I was addicted. So my GP saw I was in so much pain and prescribed me Polexia, and I was taking it probably 4 times a day for about probably 2 to 3 weeks. Then I went to hospital because the Polexia wasn't working, obviously because my body developed a tolerance to it. And I said, I've got endometriosis, I'm in so much pain. They admitted me to give me bowel prep because I was constipated from the medication, and cut me off of all painkillers. You're on Celebrex, so they'll help the endo pain. At the time, the pain specialist tried to up my dose again of Lyrica. If she would see me, I would break down. I was just very much not understanding why they weren't treating my pain and why they wanted me on Lyrica. And my dad would visit on lunch break, and he would see me in so much pain, and he would tell the nurses, like, why is she in so much pain? Like, what are they doing? Eventually, they're like, okay, we'll put you on 1 Polexia every 12 hours, fast release.
The people are so frightened of opioids that they started prescribing gabapentin and Lyrica in their place, but they actually have almost exactly the same black box warnings on them, except that Lyrica and gabapentin's black box warning includes the risk of suicidality. Opioids don't.
So what about you, Diane?
I was diagnosed with major depressive disorder and generalized anxiety disorder. I saw countless psychiatrists. A lot of the medications they were prescribing, I just couldn't tolerate the side effects at all. And these were SSRIs. 2015 was like my 5th year of medical school, and because I had suppressed a lot of things from my childhood and from when I was 16. That was when my parents got divorced. Being the oldest of my siblings, I had to take on that role of, being a strong one and just looking after them and everything. I had to suppress all of my emotions, and I didn't really even consciously do that. It worked for a while that I was excelling academically and everything. It caught up with me by like 2015. I mean, slowly my anxiety just started to escalate. I eventually in 2019 saw a new psychiatrist after I started proper treatment for my depression. I talked about endometriosis, and one of the things she just basically told me, don't think about endometriosis, and she kind of brushed it off. It's not really a big deal. She didn't really seem to have any understanding of endometriosis, but I do have a new psychiatrist that is very understanding when it comes to my medical trauma and a lot of the other trauma that I have.
I was born in Romania. I was born 6 months before the 1989 revolution. My parents were divorced when I was 4. There was domestic violence. I masked really, really well. I was about 10 years old. I actually was a whole year without my mum in Romania. There were some issues with the embassy. I learned how to people please because I was experiencing a lot of difficulties, obviously, as a child without their mother, but I didn't want to make anybody else around me sad. My auntie who was looking after me, the rest of my family, my grandma. I was actually taken to like acting classes, like a little hobby. And I learned, from really early on how to appear differently than how I felt on the inside. And this wasn't necessarily done consciously, and it's a trauma response. In my early 20s, I lost my nephew. He wasn't my biological nephew, but he was like a little brother to me. And he passed away tragically at 15. I was at university and I noticed in myself after the passing of my nephew that I definitely didn't have the best coping mechanisms. And at the time, I was actually doing a thesis about Romanian women under communism. I went back to Romania, re-traumatized myself by recording 30 interviews with all these women and people and doctors, psychologists. And I came back and I decided to take myself to a psychiatrist. And I'd never been on any medications for my mental health. After 45 minutes, I did walk out with, I think, about 5 different diagnoses, which since then have been cut down. But I did have anxiety, depression, PTSD, which now, it's complex PTSD. It's been years of multiple forms of trauma. I started having a bad time in the medical system from when my endometriosis symptoms became more and more pronounced. So I was given the Depo-Provera injection. Instead of it stopping my periods, I menstruated for 3 months straight on Zoladex. The physical sensations, it literally felt like I was in hell and that I couldn't explain to people what was going on because unfortunately, I know it sounds really dramatic and you might have listeners that have been on these sorts of medications and not had these sorts of side effects or to the same extent. And that's because I also wasn't able to take hormone replacement therapy because of my neurological disorder. So I couldn't take any of the estrogen that they might give you to counterbalance the fact that they're trying to put you in chemical menopause. And so the gynecologist at the time who did find endometriosis on my uterosacral ligaments, Patch of Douglas again, only 6 months after my first ablation, and as well as on my ureter, evident extrapelvic locations, decided to tell me, maybe it's bipolar. I was working full time. I was running events. Like one of them was an event for Buckingham Palace, and I met the now disgraced Prince. So I was managing and functioning at high levels despite these years of trauma. But after I was given these treatments and after the Zoladex, when my neurological function just decreased completely, I started looking into autism and neurodivergence, as an umbrella. And I realized a lot of the stuff that I thought was breakdowns were meltdowns, sensory related. So bright lights, multiple people talking at the same time. If I had a tag on my t-shirt, typical neurodivergent, typical autistic things. And I did end up getting an assessment done by somebody who was meant to tell me whether or not I am neurodivergent, whether I fit on the spectrum at all. So even though in terms of all the testing that they do, I fit a lot of the boxes, but he told me I was way too empathetic to be autistic. So people with autism, apparently, we are also psychopathic and also don't have empathy. If I was going through my physical symptoms really bad and then something else happened and there's multiple sources of overwhelm, I might become nonverbal. And so basically I was gaslit out of a proper autism diagnosis as well for being too empathetic, despite meeting every other criteria, and my psychologist also believing, my primary things in terms of, neurodiversity and psychology as well would be complex PTSD and autism. Have you had any complications in your diagnosis journey?
Before I got diagnosed with endo through laparoscopy, most of the doctors, even gynecologists, would say it's just pelvic pain, primary dysmenorrhea, and it'll go away. So no one really believed it was endometriosis. So at the age of 13, I had a ovarian cyst burst on my right ovary. That was excruciatingly painful. But of course, doctors didn't really think much of it. They didn't really connect the dots.
And what about you, Dan?
I think I was pretty lucky in the sense that my GP was on the ball from the beginning. He suspected endometriosis, but because the standard of care was the same regardless of whether it was, confirmed by surgery or not, he stuck with the standard treatment of oral contraceptive pills. So when I was about 23, I had an ovarian torsion, which was much like an ovarian cyst rupturing, excruciatingly painful, very much the same pain as a kidney stone. And it had been torting on and off for quite a few months, and it was pain that I had ignored until it was time for emergency surgery. But even then, after the surgery, no one picked up any endo when they were in there. And so afterwards it was like, it's all good. It was just a random one-off cyst. The cyst was too big, so I had to have a laparotomy. So I was opened up and I lost my left ovary, had my right ovary, but the gynae assured me that everything else looked fine and normal. So complications have been losing my ovary and the ovarian torsion.
So what about you, Dana?
I kind of believed that I was just one of those people that has bad periods. As a teenager, I did see a gynecologist who told me that I had some cysts. I did see a gastroenterologist because I had some stomach discomfort, and I was sort of gaslit at that point. Wasn't given a diagnosis really, was just given antacids. When I had my first complication due to endometriosis, they were suspecting appendicitis. I ended up having internal bleeding due to rupture of my left fallopian tube, which still at the time after that surgery, that wasn't diagnosed because I had a laparotomy. But basically, they were suspecting appendicitis. They were going to send me home. And afterwards, I was admitted in the Department of General Surgery. So I was told that I might have pelvic inflammatory disease, even though I did not and do not have any sexually transmitted infections, the cause of PID. I had a second complication 2 years later. So the first time that happened was in 2017. The second time, I had the exact same complication, which was rupture of my left fallopian tube. The first time it happened, it was just sutured. The second time it happened, I was admitted in the Department of Obstetrics and Gynaecology. They were suspecting an ovarian torsion. That was in 2019. I was 27 years old. That's when I was diagnosed. Both times I lost 1.5 liters of blood and needed blood transfusions. But this time I was able to have a laparoscopic surgery. The surgeon said that my left fallopian tube was very damaged and dilated, so it had to be removed. So I lost my left fallopian tube.
So, Diane, I know that you've had some complications as well. What would you like to tell us?
The standard path of treatment in Australia is combined oral contraceptive pill and or marina coil. They never talk about the treatments failing you. It's always a person failing to respond to the treatments. If they don't work, then they try with antidepressants. They usually will start with a low dose of a tricyclic antidepressant. If that doesn't work, they might add in an SSRI or an SNRI, which are different types of antidepressants, which is what Jorja alluded to in terms of serotonin syndrome. Because they're obviously very, very reluctant to start prescribing opioids, particularly for long courses of treatment, they'll then try some of the neuromodulators like gabapentin and pregabalin, which is Lyrica, which a lot of people have had. And if they don't work, the only opioid that they seem to be willing to try at the moment is Palexia, which is an atypical opioid that also has effects on your serotonin reuptake, which can also contribute to serotonin syndrome. So my doctor pretty much went down that path. So I had a laparoscopy. They did ablation on the endo that they found on the uterosacral ligament. They inserted a marina coil. The marina coil caused me unbelievable pain, super heavy bleeding. I just couldn't tolerate it at all. So it was taken out a few months after I had it inserted. And that was when my pain went from cyclical, just with my period, to constant pelvic pain. And my GP, bless her heart, was doing everything to try and reduce my pain and keep me at work, but it became medication on top of medication. So we started just with endone because we thought it was just an acute situation from the Mirena coil, that it would fade out after a little while. It got worse, so we added more endone. Then we added a long-acting opioid, so we added OxyContin into that, and then we added diazepam in case I had any sort of hypertonic pelvic floor. And on top of that, we added in Cymbalta, which is an antidepressant. I found out a few months ago that I actually had a Zoladex injection, which I don't remember having, but I was severely drug affected at the time because of diazepam, endone, OxyContin, Cymbalta. And unfortunately, I was so drug affected that my workplace thought that I had a substance use disorder, and it led to psychological workplace injury and a large dispute. And it cost me, sort of 5 years from my career. Like, there was essentially 5 years where I couldn't work full time and couldn't work properly because of post-traumatic stress disorder from a workplace situation, and also just trying to, as Jorja said, wean off of all of those various medications which weren't working. One of the lingering side effects of having taken so many different kinds of medications at reasonably high doses all at the same time for quite a while, it's left me being quite hypersensitive to other medications that affect it. I mean, I'm never going down the pregabalin and gabapentin path again. I lost the ability to read, write, speak, drive, blacked out, woke up in a laundry hamper because I couldn't figure out how to walk over it in the laundry. I just decided to sleep on it on my hands and knees. My brain couldn't work out how to get past this obstacle in front of me. One of the drugs they really like to give people with chronic pain now is ketamine. Usually they do that as an infusion, and they usually start off at quite a low dose and titrate up until you start getting side effects, and then they bring it back to where you start getting some pain relief. Unfortunately for me, my first experience with ketamine was as a bolus in the emergency department. So I had an instant allergic reaction to it, and they have tried to give it to me in infusions about 5 or 6 times since, even when I've specifically not consented to it, they have tried. But even the smallest dose I react to. So for instance, Palexia, Tramadol, which is another atypical opioid, they all have effects on serotonin reuptake activity or noradrenaline reuptake activity, and anything that has any of those effects, I end up with hallucinations, I end up with nightmares and PTSD symptoms. Those drugs in small amounts, when you test them out individually, can probably be very useful for some things. But for me, I was sort of given a lot of them all at once at reasonably high doses. Like, it's left me very wary of trying new medications, but it's also left me with very few medications that I can take, particularly for pain. So despite everybody being terrified of opioids and thinking that they're evil, unfortunately, they're one of the only medications that I can take. There's this perception that all chronic pain must be neuropathic, and the doctors don't actually listen to you talk about what your pain experience is before they just decide that it's neuropathic pain and they give you neuropathic pain medication, because there's this perception that it's only women who have anxiety or hypochondria who are going to be suffering from it. They're given these drugs and they're given them because it's like, well, we've already got them, we've got to make them useful for something. That's what I feel like they're doing, and I don't know if that's a fair judgment call or not, but that's how I feel about it. And that's been my experience with medications. So now we've sort of paired everything right back, and I take CBD and I take anti-inflammatories, but I do still carry a very high opioid load day to day, and it makes it really dangerous for the potential for me to be involved in a catastrophic injury or, requiring surgery for something that's not pelvic pain, because it means that, my risk of respiratory depression and other side effects from the high doses of opioids that I would need to feel the benefits of the pain relief from them it's a really high bar. That's not what anybody wants. And I have nothing against opioids. I love them. They keep me alive, but it's unfortunate that you do develop such a tolerance to them.
In my case, prior to my sciatic surgery, the 900 milligrams of gabapentin was doing absolutely nothing. After my sciatic surgery, I did have quite severe neuropathic pain, and I did find relief from the Lyrica. So what about you, Dana? Any complications for any of the treatments that were given to you?
I was mostly only prescribed oral contraceptives and also the progesterone only pill. I feel like I couldn't tolerate both of them. After surgery, I really needed something stronger than regular painkillers, especially around the time that I had my excision surgery in 2020, because the pain was unbearable. I needed to have my tramadol dose increased. And yeah, that did come with side effects and also the risk of serotonin syndrome, because I'm on a high dose of venlafaxine. And I was on a high dose of tramadol for quite a while after my surgery, just healing pain. I also had some sleep issues, so I was given mirtazapine, but that also, together with all of these medications, can cause serotonin syndrome. I had post-excision surgery pain for more than 6 months. My endometriosis specialist, he did refer me to a pain specialist.
I've actually seen, I think, 5 pain specialists in the last 5 years. The second last one that I saw a week before my surgery on my sciatic nerve and pelvic sidewall, he actually told me it's impossible to do that surgery, and that not only am I risking dying, because the sciatic nerve is the biggest nerve in the body, the tiniest nick, hypoxia, definitely told me not to go ahead with the surgery. And I was sent to him by the surgeon. And my surgeon tells me he just doesn't know this type of disease, and he doesn't know endometriosis in the sciatic nerve, and he doesn't know that we can excise it laparoscopically. My surgeon had only operated on one patient with endometriosis that had sciatic endo, and I knew that that particular patient had sciatic endo that was seen on imaging. The leading neuropelviologist in the world, who coined the term neuropelviology, the nerves in the pelvis, he said I'm a typical case of atypical sciatic endometriosis. I knew that I was going to be a guinea pig. So they had worked previously on sciatic endo on cadavers. So I was going to be the second person that he was trying to do this on, the second live person. When I did an MRI on my pelvic nerves and was told by an expert in Australia, he told me in my reports and to my GP that regardless of what treatment she's given, she's probably just going to keep saying that there's something wrong with them. So this is after my GP had requested surgeon that put me on the Zoladex, that has stopped the Zoladex treatment. This is after I had already had endometriosis, not just ablated, but excised from extrapelvic locations. I guess the point of this episode is to show that we can have comorbidities, we can have mental health diagnoses. I could be schizophrenic or have any other thing in the diagnostic manual for mental health and still have endometriosis that needs to be excised. One does not cancel out the other. And I believe it's the same thing with central sensitization. So even if I've now acquired a central sensitization diagnosis as a result of all these things, including the physical trauma of 3 surgeries, that does not exclude that I still have endometriosis, as seen on specialist imaging showing that I still have it on my sciatic nerve after my 5-hour surgery, and plenty of other places, including the fact there's adenomyosis and things there.
My GP sent me to a psychiatrist who wrote in the letter to my GP, all the stuff that I was talking about in my workplace was, true. I wasn't imagining things, I'm not sort of having delusions or anything like that. But what he did say was, I do think it's likely that Diane's going to have chronic pain. And knowing that I now had an endometriosis diagnosis and that I hadn't responded well to the marina coil, what he said in the letter was that he thinks it's likely I was going to always have chronic pain. And I just think that's a really interesting observation to make about someone, because it implies that chronic pain is not physical. It implies that it's entirely in your head.
I find that quite similar to Alex is always going to think there's something wrong with her treatments.
Yes, it's the implication that somehow you're imagining it, or that you want to be sick.
Let's give them some credit. Let's say they've done some research, they know what they're talking about. Even if that is the case, and there's all these mental components to chronic pain, that physical organic disease still exists in the body.
So the first pain specialist that I saw was a relatively young woman who told me that all women with pelvic pain are drug seekers, and that anybody who takes opioids is a burden on the community. And I was coming to her as a woman with pelvic pain taking opioids.
So thank you so much to my wonderful guests for joining us today. Dana, Diane, and Jorja, from the bottom of my heart, thank you for sharing these incredibly difficult experiences that you have been through. And thank you to our listeners for joining us. We will be with you next time.